And you take it, obviously you take it very slow with the patient. That's one thing I've always loved about chiropractors is that, with any type of doctor, when you go in for anything, you're always nervous. I mean, everyone's nervous. Everyone's, worried about what to expect. Do I take my clothes off? Am I going to get pricked? Am I going to, is this going to,
whatever, yeah.
is it going to hurt? And obviously what you do, is you're working with people that are in pain, just like our website talks about, having back pain and all sorts of different things. But talk about some of your patients' experiences, if you could, how they've felt.
The wide and varied experiences, too,
Of course.
We're dealing with the human body. The human body is a dynamic thing.
Yeah.
And what's so interesting to me is that everybody's a little different.
Yeah, yeah.
So I'm always trying to coach the patients or tell them, educate them on what they might expect from my treatments. Some people get real sore after an adjustment. I like to let them know that that's a possibility. Some people don't feel any different whatsoever. That's a possibility. And some people feel better. Some people feel better for, maybe an hour or 2 hours or a day, or they come back in and go, hey, I still feel better, or I feel 50% better. So it's wide and varied, But I always like to educate the patient as to what they can expect in many different aspects of that, And some people that do hurt from the adjustment, they say, well, yeah, I was sore, but you told me about that, so I'm good with it.
Right. So what types of things can you offer to people that have, say, chronic back pain? What types of advice or something that you might be able to do to help them?
Besides just the chiropractic adjustment, we do the rehab. It's extremely important to strengthen and balance the muscles in the body. Core exercises are real big right now.
Okay.
And so,
what types of exercises are those?
Well, mainly we use the gym ball. Those are really good. It's something that people can do at home. I like to teach patients to be able to take care of themselves at home. That's the main drive.
Right.
And so the gym ball is easy, right? So I teach them exercises on stretches on the gym ball so that they can do stuff at home.
Right.
And that's the end product of that. And once they start seeing the benefit of it, they're like, oh, yeah, And I tailor things so that, number one, they're easy, and number two, it doesn't take a lot of time because people, they don't want to spend an hour or two working out. So I can tailor my exercises to around between 10 and 15 minutes. It's something they can do, and they can get a very good workout and work out every muscle in their body just using the gym ball.
So you set up like a whole...
Amazing.
The gym balls, Pam?
I was going to say, it really is amazing how much you can get out of that 15 minutes, isn't it?
Oh, it is. It's remarkable. I mean, patients are amazed. They're going, I can't believe it. They're panting, sweating, all this stuff. And so I said, I had no idea. And I go, well, yeah, it's because we're using large muscle groups. We're not isolating muscles. We're using your legs, your buttocks, your low back, your upper back, your stomach, your shoulders, your arms. So we're using...
These are the things that actually help the spine to heal.
Right, absolutely.
Rather than just have a quick adjustment and then you're waiting for the next adjustment, you're actually helping the patient to get better long term.
Right.
On that note, what Pam's talking about, you also do nutrition, and I know nutrition is extraordinarily important, even when it comes to rehab with getting back healthy from an injury.
Right, exactly.
So you guys do it all. I mean, really, you do it all.
Well, I try to do a mix of things. I don't know about doing it all, but I try to do a mix of stuff. And the nutrition part is very, very, very important, too. A lot of people are unhealthy on many levels, not just their back hurts, but they have a lot of different issues, how their body functions and how true, health includes a lot of different things other than just being out of pain.
Right. Do you have any tips? Because I know that we sit behind our computers a lot. I know that if you're sitting too long or if you're not standing properly, do you have any tips to have people help maintain a healthy spine once they've gone through maybe rehabilitation?
Yeah, of course. Like everybody, I have a lot of people that do a lot of computer work. So I do a lot of stretches and exercises that they can do in their chair and utilize their desk.
Really?
Right,
interesting.
They don't have to go anywhere, yeah.
Oh,
so I teach people a whole exercise regime on how to exercise in your chair, how to stretch your back, how to challenge your muscles, all these things, and how to use your desk as a workout tool,
Yeah, I think I've read some things like that in Men's Health. So who's your average patient? Do you do like high school athletes? Do you do?
I get them all. There's no average patient. Everybody, I get the whole gamut. I've been practicing 25 years here in Austin.
Okay.
And so I just get a wide variety of patients.
I heard you say you even do babies.
Yes, absolutely.
People wouldn't think babies need a chiropractic adjustment, but
if you think about the birthing,
happen when they're born.
Right. If you think about the birthing process, and sometimes mothers have a very difficult birth. They're in labor a long time, and they're pushing, and the baby's in the canal a long time. And, sometimes the doctors get a little anxious, and they'll pull the baby out. They'll either use forceps or something like that, or just being in the canal for a long time and being pushed around and, coming out. And sometimes the babies experience trauma, birth trauma. They can have their necks and backs wrenched, and so, and that manifests itself in a lot of different symptoms, from like fussy baby syndrome, where the babies, you can't hardly hold the baby, they're arching their back, they're always crying, they're throwing up, they're having diarrhea, all these things,
Wow.
And so we just work on them and do what I do. I use the electrical adjusting instrument, which is very, 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 very gentle, and we just adjust the baby using that while the mother's holding the baby, and lo and behold, most of them just get a lot better. It's pretty amazing.
And then you have to help the mother too after a pregnancy or even during a pregnancy. I'm sure there's a lot of back pain.
Right, a lot of moms get out of alignment really bad, and also the nursing aspect of it. They're not used to holding a baby in that position, and so they end up getting a lot of neck and upper back pain.
Yeah.
A lot of moms do that, upper neck and upper back pain. So, there's just all kinds of things that come along with the birthing of a baby, not from the baby's but the mother's standpoint too.
Dr. Vance, let me ask you another question. A lot of people are trying to lose weight right now. Okay, and actually, I just went through a really intense regime of weight loss over the last year, and I noticed that my lower back started to hurt after I lost the weight. Does that have a lot to? Do you get a lot of patients that come in that you can offer? I know no one would think about this, but until you experience it yourself, where you're talking about rehabilitating the muscles. Do you see that very common with people who lose a lot of weight?
Yes, again, the body's a dynamic thing. Everybody's different, and some people, some people get a lot better. Like feet and knees are the first thing to start feeling better once a person loses weight.
Yep.
And then also we're concerned about things like cholesterol and digestion and all these other things. And so when someone wants to lose weight, I don't necessarily do a weight loss program.
Right.
As such. I don't tout it as that. I try to. I have a cleanse that I use from Standard Process, which is a great company. Everything they have is organic. They grow their own food. They process their own supplements, so it's all done right there, and it's the highest quality. So we do what we call a purification or sort of a detox. And what it actually is, it heals the digestive system. It helps to